Wisdom tooth surgery, or third molar surgery, is a common thing that we do in the practice of oral and maxillofacial surgery. They're the teeth that are the last to come in. They're the furthest back, and the vast majority of the times, the patients don't have enough room in their mouth to accommodate them. So when they end up getting in situations where they can't come in appropriately, either they'll get partly through, and oftentimes that's going to cause pain. It can cause damage to your adjacent teeth. It can cause periodontal problems with the adjacent teeth, infections, and some of the infections can be quite serious. And then when they're not through all the way, they can form cysts, or rarely tumors, and they can cause other damage to the adjacent teeth as well. So when you look at, from a long-term standpoint, a teenager, a young adult, a vast majority of those people are going to have symptoms in some fashion, probably before they're 30 years old.
We'd recommend when if they're regularly followed by their general dentist when the general dentist feels that they're ready for that. But we also recommend them to come in at anywhere from the age of 14 to 18. That's the first time I would say investigate and figure out to see if they're ready for removal.
For starters, come in, get to know us, meet us and our staff. I think first of all, you need to be comfortable with us, and we need to be, obviously, of course, we'll be comfortable with you, but I think it's important that you get to know us as a staff. Once you're here, then we'll need to get a full-length medical history on you. A lot of times this is people's first time undergoing sedation or surgery, so we need to make sure that they're healthy enough and no red flags from our standpoint. Once we've deemed you're a good candidate for the surgery, then we'll set you up to be seen. Typically we'll do one evaluation first, and then we set you up for the surgery date itself. For the majority of our patients, we're putting them to sleep under IV, just general anesthesia, and so the big things will be nothing to eat or drink the night before after midnight, and then they'll need a ride with them that day.
The beauty of wisdom teeth, unless the patient has undergone an active infection or significant problem beforehand, is it can be scheduled and it can be planned. And this is a procedure, the outcomes are infinitely better if you can plan it. Planning is so important. You can write prescriptions ahead of time, and these prescriptions will help prevent infection. They can help prevent alveolitis, which is a dry socket. Preparation literally, again, reduces complications, improves recovery time. So that is why we do like to see patients for a consult. It dramatically improves their outcome, as well as our ability to plan and make sure we have the appropriate equipment available to take care of the patient well. And this is a procedure that affords the luxury of planning, and everyone should take advantage of it because it really will improve their outcomes.
The day of the surgery, most of the patients are doing this while they're asleep. We have some do it while they're awake who do well, but most people want to be asleep, and so they're coming in with an empty stomach, nothing to eat or drink, for about 6 hours beforehand, except we do have them take some medication with some water beforehand, and they're coming with a driver, and we spray numbing medicine on their arm before we put a small catheter into one of the veins, and most patients don't even feel that go in. And that tends to be the hardest part for them in terms of their nervousness, and then once they get over that hurdle, they're like, oh, that wasn't a big deal. And then we give them medicine through it that puts them to sleep. They're fully monitored, and we have two well-trained assistants in the room with each of those patient cases that's being done with IV anesthesia. And once they're asleep, we numb the areas, or I numb the areas where the teeth are, take the teeth out, put dissolving stitches in, and have them bite down on gauze, and then they wake up, and they wake up in all sorts of state of emotional awareness, if you will. You have a lot of patients that don't believe that they're done, and we have to tell them repeatedly that we finished the case, and they think we're joking with them.
Some of the issues that we hear from patients about, or some of the issues that we see patients run into after surgery, are what I call the big three: the pain, bleeding, and swelling. Pain is usually minimal. Some have a little more than they'd like to experience, and we have ways to deal with that. Bleeding is minimal also, and swelling is variable. If you do get swelling, usually it's in the first 3 to 4 days and then dissipates after that. Sometimes we'll see some post-op nausea, and we have great medicines on the market to be able to deal with that.
The post-operative phase for wisdom teeth, as soon as you get home, we typically recommend that you start with your analgesics, in other words, your pain medicine, before the numbing goes away. That's a big help. We found also that staying on and typically we prescribe a non-narcotic regimen for wisdom teeth. And staying on this regimen very, very religiously for every 6 hours, taking another dose of medication, not waiting for the pain and then playing catch up, but staying ahead of it, helps tremendously. You are going to have some discomfort afterwards. There's no question about it. The medication doesn't erase it, doesn't make it go away, but it makes it manageable. And there are other alternatives in case your medication is not adequate to control your postoperative pain. Again, the on-call doctor is very helpful in this regard. So, bottom line is, you're going to have some discomfort. It's going to increase over about a 3-day period. It usually peaks on the 3rd day and then starts decreasing. Typically, when patients come back to see me, if they hadn't had to come back earlier for some other issue, after a week to 10 days, most of the time you're feeling pretty much back to normal. Not 100%, still a little tender at the surgical site. And then when you come in for your postoperative exam, you'll have, typically with most wisdom teeth, little craters where the teeth used to be, and your body is going to heal these up, and those are actually desirable to have the little openings, because if your body heals too fast and closes those up too quickly, that could be a source of infection. And then when you come back at a week, what we do is we show you how to keep those little areas where the gums are healing and the jawbone is healing clean with an irrigation syringe, and the body pretty much takes care of it.